A continuación, la charla Selfies para la salud, la nueva frontera de la evaluación de signos vitales con IA, presentada por Sara Banabach. Una mirada audaz a cómo la inteligencia artificial está transformando lo cotidiano en herramientas clínicas de vanguardia.
Buen día, everyone. Thank you so much for having me, and apologies I couldn't be there in person, and I'm sure you're having an inspiring time with the amazing innovative program that the FCV team has brought together for you. My name is Sara Banavash, and I'm based in the Netherlands, and I lead the sales and partnerships across the EMEA and LATAM regions at Neurologics, where we work at the intersection of AI and human health and wellness. I'm truly honored to present virtually at WELLS 2025 and excited to share with you a glimpse into the new frontier of health monitoring, where the combination of AI with a simple selfie can unlock active, vital, and preventative health data in just seconds. Here's what we'll be covering in the next minutes. We'll start with the health monitoring challenge and what we're all up against. Then we'll explore why AI innovation represents more than just a trend, but a turning point as the new frontier in proactive health. We'll see what a decentralized digital-first healthcare system could look like. Then I will introduce Neurologics and Anura as a real-world example of that future already in action, along with some use case examples. And finally, I'll close with a broader reflection on what selfies for health really means for the future of healthcare. Imagine this. You sit down, you look at your phone, and in 30 seconds, it reads your blood pressure, heart rate, stress levels, even your diabetes risk. No contact, no cough, no clinic visit. And it's not a gimmick. It's not a vision for the future. It's here, it's working, and it's backed by real clinical data. What would that mean for screening, for follow-up care, for patients who can't easily access specialists? That's the world we're in right now, and the demand for solutions that are remote, fast, scalable, and accessible keeps on growing with every wave of chronic disease. Before we talk about solutions, we need to understand the challenges, which are various around the world, including LATAM, where we keep facing a rise in chronic conditions, hypertension, fatty liver disease, stress-related illness, and these conditions that develop silently over time often remain undetected until it's too late. Other problems include that our current monitoring systems are too reactive. Patients are diagnosed after symptoms appear, when intervention is more costly and less effective. And even when tools exist, like blood pressure cuffs or wearables, they're not always available, affordable, or used consistently. And the result? A huge portion of the population, especially in rural or underserved areas, goes without reliable tracking of their vital health indicators. So there is a gap that we need to close, and that is why we're entering a new frontier. So let's shine a light on our current system, which is in a state of crisis, which is for understandable reasons. So healthcare systems are under immense strain, facing rising costs, aging populations, and growing demands for care. But the consequences are becoming life-threatening. We end up waiting for symptoms to appear. We wait for pain, we wait for disease to progress, and then we treat. But what if we could anticipate instead? And what if a system could quietly observe subtle changes, like blood pressure rising, stress accumulating, before the patient even realizes it? That's the promise of predictive health. and AI allows us to shift the timeline. So instead of treating disease at stage 3, we intervene at stage 0. Instead of a hospital visit, we prompt a lifestyle change. Instead of silence, we give patients a signal they can act on, especially in resource-limited environments. This is something truly transformative because it means we can reduce hospital burden, save costs, and most importantly, preserve lives. And let's be clear, it's not just about machines. The real power is not just in the algorithms, but in helping people take meaningful action early on for their own health. And that's why preventative care shouldn't just be a strategy, but it should be set as the foundation of sustainable healthcare. And that's why the mindset of predictive medicine is the next evolution in how we care. So using AI and broad health datasets, we can now forecast risks and offer personalized guidance before there's a crisis. So this isn't just about diagnosis, it's about proactive support. But to get there, we need data, and data that is reliable, representative, and ethically sourced. The promise is huge. Healthier outcomes, efficient and effective workflows, and potentially longer lifespans. But we also need to overcome the barriers when it comes to data ownership, which is fragmented across multiple systems and devices. Trust in AI, while improving, is still fragile, and legacy healthcare systems, which aren't always quick to change. On top of that, there's regulatory requirements, as software or devices intended for medical use must meet strict compliance standards that vary across regions. So if we want to unlock the full potential of predictive care, we need to earn trust through transparency, validation, and patient-centric design. And that's where all of us, technologists, clinicians, and public health leaders, have a shared role to play. So, what does the future look like? It's digital first, yes, but it's also decentralized, data-driven, and deeply human. We're entering a new era where healthcare will happen in a hybrid way, wherever the person is, even on the go. So it's not just clinics or hospitals. This means that the potential to deliver care is through mobile companion apps, virtual teleconsultations, home monitoring, community health workers, and yes, AI. And let's be honest, AI is already everywhere in the healthcare space. You've probably seen it in diagnostic imaging, chat symptom checkers, triage bots, refilling prescriptions, even the prediction of disease outbreaks. In wellness, it's used to personalize fitness plans, analyze sleep patterns, or recommend mindfulness routines. In medical research, it's speeding up drug discovery and analyzing massive data sets to find trends that human eyes would typically miss. So we're at a moment where AI isn't a future technology, it's part of the present landscape. The question now is, how do we use it responsibly, inclusively, and effectively? And let's be clear again, digital tools will not replace clinicians, but they will help clinicians do more, reach more people, and make faster, better informed decisions. So think of AI not as a doctor in itself, but as a second set of eyes, a triage assistant, an engagement tool, and a coach. And while AI handles the repetitive tasks and alerts, humans remain irreplaceable for empathy, ethics, and expertise. And this is especially important when we talk about scaling access in LATAM, where mobile device penetration often outpaces clinic density. And something very aware of when building a digital solution is the fact that patients often abandon tools when they're too complex, require extra devices, or feel impersonal. Therefore, simplicity, speed, and intuitive design are not just nice to haves, they're essential for engagement, trust, and long-term success. Now, let me show you a real-world example putting this vision into practice. Enter the 30-second video selfie solution called Anura. At Neurologics, we've developed a patented technique called transdermal optical imaging, which builds upon the science of remote RPPG technology that works by analyzing the light that gets reflected off the skin. So when your heart beats, the blood flow slightly changes the color of your face, changes so subtle that they're invisible to the human eye, but not to the camera. We analyzed 23 different points across the face, and rather than looking at the surface of the skin, we're capturing the signal beneath the skin. And that's the magic of combining light waves, computer vision, and artificial intelligence. So that light-based signal is then sent to our DeepFX cloud hosted on the Amazon Web Service, where we extract meaningful data and return over 30 vital signals. And this includes heart rate and blood pressure, BMI, stress, heart rate variability, cardiovascular and metabolic disease risks, and fasting blood glucose, and even more. No expensive hardware or wearables are required, just a smart device with a camera. And we can also complement other points to boost the overall health picture, creating what's often referred to as a digital twin for a more holistic and data-rich representation of the patient or user. And this is how it works. So the user opens the application or interface, a 30-second selfie video is captured, then our AI analyzes the encrypted and anonymized blood flow changes in real time. The secure cloud processing delivers the metrics directly to the user or clinician, and the results are delivered in a clear, user-friendly way directly to the user or clinician. And these results can also be pulled via an API to a clinician's dashboard or integrated directly into the patient's electronic health record. So it's completely contactless, fast, and requires no calibration. And you can easily pair this solution with things like coaching, nutrition plans, or fitness programs, making it a powerful starting point for wellness and prevention. And it's an ideal solution for clinics or hospital waiting room, as well as to help streamline workflows by capturing key pre-appointment vitals and assessing health risks to give doctors a helpful snapshot of a patient's state before the consultation even begins. And we're proud to say that this technology is clinically validated and benchmarked for medical-grade accuracy. There are multiple peer-reviewed studies, including one from the American Heart Association, that supports the application of this technology in clinical settings. We're also actively going through regulatory pathways, including FDA and CE submissions in several jurisdictions around the world. So at present, the solution is classified as a wellness application, as a screening tool, and it's already being used in a medical environment. As long as we're not making any medical diagnostic claims, it can be used broadly, even within clinical workflows. And from what we're seeing in the field, AI is no longer optional in telehealth. It's becoming essential. It helps drive better engagement, enables more proactive care, and bridges gaps in access. Now, there are various use cases where selfies for health are already making a difference. One major application is hypertension management, where patients can scan themselves daily from the comfort of their homes, and results are securely shared with the healthcare providers. This supports continuity of care, flags elevated risks, and most importantly, encourages better adherence to treatment plans, because it turns passive monitoring into an active, engaging experience. Another example is in cardiac rehab and chronic care, where consistent feedback is critical after discharge. With Selfie Health, patients can monitor their vitals remotely to help reduce readmissions and provide peace of mind. It's a lightweight tool delivering heavyweight insights. And we all still remember how during the recent pandemic, digital health proved its value. So companion apps like Anura helped extend care beyond hospital walls to enable virtual health consultations and digital checkups. Now, the focus is on making these tools a long-term part of everyday care. And to build on that for public health campaigns, these type of health selfies has been deployed using tablets and kiosks in workplaces, events, and remote regions. It all enables rapid, large-scale vitals and risk screening without needing labs or specialist staff. So as we wrap up, I want to return to our central idea, selfies for health. It may sound novel, but the underlying concept is profound. We can use the devices we already have to generate powerful insights that can change how, when, and where we deliver care. This is a new frontier because it challenges the norms. It reduces reliance on physical infrastructure, decentralizes diagnostics, and empowers both patients and providers. AI technologies, especially selfies for health, give us scalable, ethical tools to move from reactive treatment to proactive health. And while we're only beginning to scratch the surface of what's possible, the technology is already here and now. And what comes next is how we choose to apply it together. So let me leave you with this. A selfie today could be a lifeline tomorrow. Technology is not the solution by itself, but when it serves people, when it gives someone an early warning, a moment of insight, or a connection to care, that's when it becomes the most powerful. So let's use the tools that we already have today. Let's bring healthcare closer, sooner, and smarter. Let's reimagine healthcare prevention together. I also invite you to try out the free lightweight version of Anura, which you can directly download from the app stores, or contact me directly to get the full evaluation version of the solution. So yes, let's connect and let's shape the future of digital health. Whether you're interested in research, implementation, or just brainstorming what's next, I'd love to speak to you. Thank you so much for your time and enjoy the rest of your symposium.